IAP stands for Increasing Access to Psychological Therapies, and it was really an initiative to help people with mild to moderate depression and anxiety who might not feel they want to go to the doctor's surgery and talk to their doctor about it. They might just want to come straight to people who are trained to help deal with it. So they can have an open referral system. There's a free phone telephone number, so they can phone the service and speak to a therapist.
You also mentioned to me when we were talking a bit earlier about some group therapy work.
So if somebody's got mild depression, maybe just finding it hard to get up in the morning, get off to work and things are just getting a bit too much, they can phone some of our therapists and they will speak to them for 2, 3, 4, 5 weeks and just generally get them going again, give them some sort of behavioural activities to do, perhaps one pleasurable thing a day, a chore a day, and something that they need to get done, and just build things up in bite-sized chunks so they feel they're succeeding. Some people might want to actually see a therapist face-to-face, perhaps their problems are a little bit more severe. And then they can be booked in to see somebody, and that can be anywhere in the community. It can be at a doctor's surgery or a library, so they don't feel they have to go to their own GP, or they don't have to go to a mental health place that they might feel a bit uncomfortable about it. It's about people accessing the service where they want to access it. And then they can see a therapist who might do some thought work, so they look at their thoughts about how negative they've been thinking and help just to turn it round a little bit so they can be a bit more positive, challenge all their negative thoughts, and again help them to activate their behaviour so that they can start doing more positive things with their life.
And is that kind of known as cognitive behavioural therapy?
That's
or
the cognitive
CBT?
behavioural therapy.
So things that some people out there would have
Absolutely,
heard.
yeah.
Of
And
those
then
theories.
so they can speak to therapists on the phone or see them face to face, or we're running 4 groups, and we're running a group called Axe Your Anxiety, obviously for people with anxiety, Soothe Your Stress, Lift Your Low Self-Esteem, and Boost Your Mood. And the Boost Your Mood one is for people with depression, and again it's about getting them going, giving them the motivation to sort of schedule things into their daily timetable, do some exercise, look after their sleep and diet.
And how many sessions would that be, Jan?
The groups are generally between 6 and 8 weeks.
Okay, and are they evening run or in the day?
Most of the groups are in the evening, but we try to run one group at least each term in the daytime for people to access that maybe don't go to work and can only access it in the daytime, perhaps when the children are at school.